8:43. Welcome back to Q13 News this morning. An important conversation we want to have here this morning. Netflix Series 3 of 13 Reasons Why, expected to be released sometimes this summer. It's kind of a controversial show. It surrounds the issue of suicide in teens. A lot of parents concerned, and they might want to be, because there's been research that shows there are, unfortunately, some side effects and a spike in suicides even after the show has been released, which is just one of the mental health concerns that a lot of parents are probably feeling as summer is getting underway, as school is getting out. So we want to have this bigger conversation about teens and mental health, which is why we've asked Jessica Henneman here from the Adolescent Center at Kaiser Permanente to join us this morning. I want to talk in general terms first, if we can. What should parents know when it comes to teens and mental health in general? What should they hear?
Well, I think there's a lot of misconceptions that I hear out in the community. First, that teens don't have anything to worry about, that they don't have anxiety or depression. But we know that 1 in 5 teens will experience anxiety or depression during their adolescent period. So it's really important to start that conversation. Another misconception I hear is that by talking about suicide, it will lead to suicide. And we know that one way to reduce suicide is actually to talk to kids about mental health and what their concerns are. So starting that conversation is really important.
As a parent, I can understand this. It's a scary thing to talk about with your kids. So are there signs that I could watch for, or things that I need to kind of have on my radar?
There are. So it's really common for teens to have emotional ups and downs day to day and week to week, and that can be a normal part of the adolescent process. But when those changes are significantly different, or there's a change from the norm for that teen's behavior, then that can be a sign that maybe there's something going on. If there's a significant mood change, more irritability, more tearfulness, more anxiety, that would be a cause for concern that parents might want to start that conversation. Again, if there are changes in the teen's sleeping habits or eating habits, too much or too little, if they stop participating in social activities that they previously had enjoyed, if they begin isolating themselves from friends or family, or if there's a significant change in their academic functioning, those are all warning signs and should heighten a parent's level of concern. If at any point suicide is brought up, then obviously that should heighten a parent's level of concern, and they might need to seek care more urgently.
So May is Mental Health Awareness Month, which is one of the reasons we're having this conversation. How do you have that conversation with your teens about mental health? I mean, because honestly, sometimes those symptoms could just be the moody teen, and you're like, do I have the conversation? Do I not? How do I do it?
Yeah, so letting parents know that if they let their kid know in a calm, non-judgmental way that they are concerned, that's an important step. Many kids may feel like they're alone in their concern, and that they have to deal with this emotional issue all by themselves. So feeling validated and also normalizing that mental health concerns can come up can be a great step for parents. To have the conversation, I tell parents to have it in a low stress environment, maybe in an environment of the teen's choice, or while doing an activity together, can all help to relieve the anxiety that the kid and the parent might be having around this conversation, and making sure that the teen has a safe and trusted adult to talk to if that isn't the parent.
So I shouldn't walk up and close the door and be like, and now we're going to have a really important conversation.
Maybe not.
Yeah, that seems like a bad idea. All right, I'm not alone, though. There's lots of help and lots of backup, really, especially in this community, if we want to have these conversations, or if I see some of these warning signs.
Yes, there are lots of resources available to parents and also to teens. We don't expect any parent to have all the information, and they can reach out to their primary care provider or even their teen's school, where there's school counseling and nursing staff available. And we are so lucky in this area that we have school-based health sites or health clinics at many of our high schools that they can access care directly at. If a parent doesn't feel comfortable having that conversation, again, letting their child know that there are other people that can help have that conversation is important. There are many great website resources and hotlines that parents can look at beforehand, before having this conversation, to let their child know that there are places they can find help. If at any point a parent is worried that a teen is in crisis, though, they should seek care immediately. We have some local mental health crisis centers and support teams that can help that, or they can take their child to the nearest local emergency room to be assessed.
Jessica, thank you very much for being here. As we finish this segment, I want to show one more time the graphic of helpful information and places that you can go. There's the National Suicide Prevention Lifeline. There's the Crisis Text Line, both open 24/7, and then kp.org/WA for more information about what you're doing as well. Jessica, thank you very much for being here.
So much.
Hopefully this has helped some parents start a good conversation as summer starts.
Yes.
Appreciate it very much. All right, MJ, let's talk about